Listen now to a talk Ben Friedman had with Dr. Irina Savelieva, an electrophysiologist at St. George's Hospital in London, England. They discuss updates on novel oral anticoagulants and catheter ablation for atrial fibrillation.
Now, I guess we've heard a lot more about atrial fibrillation in the last 10 years than we had in the past, but I wonder if you can start with what's new about the not so new or not so novel NOACs. I think now the NOACs have been changed, their name has changed to non-vitamin K dependent oral anticoagulants. What's new with the NOACs?
That's right, Ben, thank you. What's new about NOACs is that now, after their large-scale trials results have been published, we are looking at their efficacy and safety in specific settings. And what would be interesting during this meeting to learn is how they perform in patients who are undergoing cardioversion. And the results of the X-Vert trial with rivaroxaban that recruited 1,500 patients and completed the analysis will be presented at this meeting. Perhaps this may change our approach to managing patients undergoing cardioversion in the future instead of waiting for a long time until they are therapeutically anticoagulated on warfarin.
Well, I think that's important, but if we continue on the acute cardioversion, is there anything new in chemical cardioversion for atrial fibrillation?
Well, after certain failure of a relatively new drug, vernaculant, which is not approved in the United States and it's not really very widely used in Europe currently, there is some cautious development of an interesting drug called vanoxerin. This drug actually has been developed as therapy for Parkinson's disease and for depression, but didn't work in that particular condition. However, its antiarrhythmic properties have been discovered, and in a dose-ranging trial that was presented at the American Heart Association session last November, this drug was associated with a remarkable 84% conversion rates in patients with persistent atrial fibrillation.
So perhaps there'll be some further development in that area because up till now it's been somewhat depressingly hard to get a new drug.
That's our hope for this particular drug.
Once you've got someone into sinus rhythm, what about maintaining sinus rhythm? What's new there?
Unfortunately, here we still somewhere conservative, back in 90s when dofetilide was introduced, and dofetilide is used in the United States quite a lot, we know about that, but not worldwide that widely. It's not used in many countries in Europe. So in Europe, we're limited to good old amiodarone, class 1C agents, and sotalol. But interestingly enough, recently, a drug that is licensed for treatment of stable angina, ranolazine, has been found to have an interesting antiarrhythmic potential that has been evaluated in 2 clinical trials. One of them was the Rafaela trial that looked at the efficacy of ranolazine in maintaining sinus rhythm after electrical cardioversion. And this trial, although did not reach statistical significance with regard to its primary endpoint, still showed that ranolazine at higher doses was associated with significantly higher likelihood of surviving in sinus rhythm after 16 weeks of treatment. Now, with dronedarone, that's an interesting story. It's not very widely used in Europe. It's only 11% out of the antiarrhythmic drug potential. The antiarrhythmic potential of dronedarone, lower doses in combination with ranolazine, has been discovered and has been studied in the Harmony study. Again, the results are available, and this was a study in 134 patients implanted with pacemakers. The patients who are notoriously difficult to recruit, but nevertheless, the results of this study were remarkable in that the combination of 2 drugs really suppressed atrial fibrillation burden by about 60%. So that holds a significant promise because obviously this combination looks both efficacious and safe.
Well, that would be a real boon because at the moment the rhythm control approach is really not working, mainly because the drugs are not all that effective or else toxic. So having something that's either more effective or less toxic would be very useful. Is there anything new in ablation, which is also one of the approaches that we use to maintain sinus rhythm?
I would like to emphasize that there is a certain paradigm shift in terms of how we use ablation currently. We are moving from treating it as a technological advanced tool that would be used in the minority of patients, looking at the short-term outcomes such as rhythm control, to assessing the hard endpoints and applicability of this therapy in wider population. I think the results of 3 ongoing trials, the ACCELEF, CAPANA, and EAST, that look at these hard endpoints, such as all-cause mortality, cardiovascular mortality, and cardiovascular or heart failure hospitalizations, would be a significant breakthrough.
Well, I agree with that if that was the case. Do you think, though, that this is going to be the answer to the problem of atrial fibrillation in the elderly, which is the burgeoning problem that we're seeing now?
Well, I think that it's better be, because now we are facing a true atrial fibrillation epidemic. Nowadays, we're proactively looking for atrial fibrillation, and I guess that we may create more troubles for ourselves by identifying more and more patients with atrial fibrillation. However, it is incredibly important that all the programs and systems that look at this active searching for patients with atrial fibrillation with various devices at the population level and in specific settings, because then we identify those patients whose health and life could be saved with early intervention.
Well, I think that's right. But I guess in this group, you've got a group of people or patients who didn't realize they had a problem before. And so symptomatic control is not so much the issue for them. It's really reducing stroke and death. And so I agree with you. It's good to look for them. Do you think this is a change that's going to happen in the future?
Yeah, it's happening already. It's a number of studies and systematic analysis have been published that reported that it's indeed unrecognized atrial fibrillation is a big issue in the society.
So I think we've covered quite a range of areas there of what might be new, but I think what's obvious is that atrial fibrillation is going to be a big problem, and so we would like to see that we're doing a little bit better. So I'm very pleased that you have got some news and perhaps some hope of something new on the horizon. So thanks very much for coming.
Thank you.